This is Report Card. My name is Iyas Oyali Peters. And Report Card, like we always tell you, it's that platform where we x-ray achievement cards of persons in public and political office in Nigeria and Africa. We put it out there for Nigerians and Africans to see what they are doing in those trusted positions. And on Report Card today, I have a development expert. We had him on the last section or segments of Report Card, and he did quite beautifully. And today, we still have him in our studio. He is Dr. Cletcent Ako, a development expert to Report Card. I just had to bring you back because I enjoy the way you handle certain things and certain issues when it comes to development in Nigeria and Africa. So, Dr. Clet, it's good to have you on Report Card today.
Thank you, beautiful audience globally. It's always been my pleasure and excitement to be on this wonderful program, Report Card. It's quite inspiring.
On Report Card, what we do is we serve the people. We put what the persons you put in certain and several positions, we put their report card for you to x-ray, analyze, comment, and tell us what you think about their performances. So on Report Card today, we have the report card for the Honorable Minister for Health and Social Welfare, Professor Muhammad Ali Pate. He sent in his report card, you can call it stewardship card, for us to put it out there for Nigerians to see what he is doing to add value, quality to their lives and service. So, Dr. Clet will be x-raying and, let's say, highlighting the stewardship card, the report card for the Honorable Minister for Health and Social Welfare, Professor Muhammad Ali Pate. He sent it and said we should put it out there for Nigerians to see. So, on your report device, the report card device, it is there. So, I think we can start from you.
Okay, very well.
I think what we had there first is he was also able to do something I would expect every other public and political office holder to do. He sent us what he met.
Exactly. The situation on ground. That's
situation on ground.
That's the best way to report, you know.
Situation on ground is.
Tell me that you 30 skyscrapers, then I don't understand what was on ground.
Before.
My appreciation for you will be less.
Yes. So here we have what the Honorable Minister for Health met on ground.
Yeah.
And what he did. So let's start.
Okay, fantastic.
With what he met.
What we met, I would like to emphasize that the very foundation for appreciation for any development is the well-being of the people you're offering that development to. So when it comes to democracy and governance, the well-being of the nation is critical and is pivoted on health.
Health.
So if people live in beautiful houses, fly wonderful roads, and they have all those dividends of democracy without a good health infrastructure, then we can say that their appreciation will be less appreciative. Because the old saying says, they say health is wealth.
Health is always wealth.
Yeah, where there's health is wealth, where there's health. So on the report card today, we'll find out that what he sent pre-2023 before he got into power was systemic weakness.
Yes, and then this health initiative is called the Renewed Hope Agenda Health Sector Transformation. That is what.
Exactly.
Yes, that is what they sent. The Renewed Hope Agenda Health Sector Transformation. Okay, so
pivotally. So I think it's better that we'll be able to share with our audience what he actually met on ground. Systemic weakness is what was titled Poor Primary Healthcare Infrastructure, that is PHC, and 21% of PHC met level 2 readiness. The situation were poor, they were not effective, and primary healthcare, I must say, is a driver of any national healthcare because that's what reach the entire people.
Okay.
Every society have
Okay,
primary.
for time, let's just read it and then before we do the highlights.
Okay, health workers shortage, Japa syndrome, 16,000 migrated
In 5 years.
Yeah.
Please take that again.
It said health workers shortage,
The Japa
Japa syndrome,
syndrome, 16,000 migrated.
Our health workers,
Migrated.
doctors, nurses, and all the value chain migrated because of their harsh situation.
Just in 5 years. So imagine if 16,000 migrated in every 5 years.
And that's it's a dire crisis for our health sector in Nigeria.
Okay.
Limited insurance coverage.
Limited health.
Health insurance coverage. That's about 9% in most states. That's sad. Far below average in global standardization. Weak local production. Minimal local manufacturing of medicine. So if you cannot produce, it's a capital flight. High maternal mortality rates. 512 per 100,000
lives
per births.
Now this is serious. Please say that again.
It said high maternal mortality rate. For our audience that does not understand those medical terms, is that for every child that is born, majority of them would die because of lack of basic healthcare need within the environment or the locations where they were born. And the state rate here is quite intimidating. It said it's 512 per 100,000 live births. Mathematician and statistician can do the equation.
Child mortality trend.
Child mortality trends, infant mortality reduced, only aligned with 69 to 62%, 2013 to 2023.
Infant mortality reduced only slightly, 69 and 63 within 2013 to 2023.
Exactly.
But that's alarming.
Quite alarming. Then he gave an example of the US mortality for 127 to 110.
Sure.
So there is a far cry for what the US has achieved for themselves and what we have done.
We're not no comparison here, but at the same time we should do better because lives are
important. Nigerian exists because people need to live as Nigerians, though.
So now, very importantly, what has been done? So what the Honorable Minister has done on what he met on ground. So please, I'll start with that. It said strong national leadership. Strong national leadership. Health sector renewal compact signed by President Tinubu with governors and partners. Okay, the sector-wide approach called the SWAP. Quarterly national, state, local government area reviews, joint annual reviews with tracked communiques.
Yeah.
Okay. Now, policy transformation. 21 strategic health policies approved, including national policy on health workforce migration, revised policies on IPC, food safety, NCDs, and maternal health. Executive order unlocking the healthcare value chain, traditional medicine strategy and ethics code. Take it from here.
Yeah, primary healthcare revitalization. He said, the report has stated categorically here that over 1,003 PHCs fully revitalized with 5,500 more on the way. I would say from my field experience that this is huge. But of course, like we say in report card, you need to go back and make this confirmation as a citizen, a responsible citizen.
Okay, now, over 37 million primary health care visits recorded in Q1 of 2025. I'll take that again. Over 37 million primary health care visits recorded in the first quarter of 2025. Over to you.
All right, it's a visible PHC upgrade worldwide. Visible PHC upgrade nationwide, rather.
Yes.
beg your pardon,
Yes.
before and after documentation provided. What they did was apt. They provided where they met it and what they've done, so that our audience and Nigerian citizens, and of course, people in diaspora that watch this platform can go and make their verification themselves to be, is it right or is it wrong? We're waiting for your feedback. It said maternal and neonatal health, mommy initiative.
I said maternal and neonatal health, the Mommy Initiative. Okay.
Yeah.
The Mom 2 Initiative. Okay, I think the
Yeah.
Mom 2 Initiative.
Okay,
Whatever.
maternal and neonatal health, mommy initiative. Okay, it says 772 priorities.
So 172 priority.
Yeah,
local government area.
172 priority local governments targeted for intervention.
Oh.
Key
Okay.
achievements.
Okay, so that was targeted for interventions
Yes.
from those local governments. Now, these are the key achievements.
Yes. He said 13.1 million antenatal,
Antenatal
13.1 million antenatal visits, 4.2 million skilled deliveries, 6 million women receive micronutrient supplements, then free cesarean sections conducted.
I think for this free cesarean sections and this micronutrient supplements is actually very key. It also plays a very huge role about this maternal death rate issue. And when you talk about those nutrients, children actually need those nutrients. And when you talk about free cesarean sections are really, really very expensive. Be it government hospitals or even private hospitals. When the moment cesarean section is mentioned, you see the husband or the wife, they begin to, hey, where do we get that money from? But of course, it has to be expensive though, because a lot is involved. A lot is involved.
Expertise equipment.
A lot of. So please, you will go again with, okay, after that, the free cesarean section conducted.
Yeah.
We'll go to
5, workforce expansion, which is critical. It says 61,700 frontline workers trained. And
Okay.
training capacity increased by 32% between 2023, when they came on board, and 2024. It says 60,000 midwife kits distributed by First Lady of the Federation.
Okay, Her Excellency
Excellency
Oluremi Tinubu.
Tinubu, yeah.
Okay,
And
midwife kits distributed by the
distributed,
first.
yeah, by the First Lady. It said enrollment of nurses grew from 28K to
115,000. Now that's
Interesting.
something else. Okay, but Nigerians, this report will be the full reports will be on the Report Card Africa blog, and it will be on our platforms. Please check these things out. Find out, do your own research, and please get back to us. Like we always say, Report Card is for you. You are the real judges. You are the research persons. Make your findings and then hit us on this platform. Let us know what these things are for you and if these things cut it for you. We still have the report card for the Honorable Minister for Health and Social Welfare, Professor Mohammed Pate, on report card. So, Dr. Kless,
Yeah.
let's go.
Okay, interestingly, I would want to say this. The priority given to health from the report card we have here, it's quite assuring. And of course, we need to run through because of time.
Please, I think we still have like 2 minutes before we go on the break.
Okay.
I have like 2 minutes before we go on the break. And
So what we move to is health insurance expansion. It's a 4 million new enrollees in 1 year. That's quite interesting.
4 million new enrollees
In 1 year.
in a year.
20 million Nigerians now covered under
the National Health Insurance
Agency
and BHCPF.
Special funds for cancer, dialysis, and
catastrophic illness.
It's
Okay,
very good
they'll
because,
take
of course,
special funds for
special
cancer,
fund.
dialysis, and catastrophic
That's quite
illness.
encouraging. You know what it takes for cancer patients,
dialysis,
dialysis and all that. It's a whole lot of money. But if the state, if under the current administration renewal agenda, if the minister has pushed for such initiative, I think it's quite.
So if there are special funds, I think Nigerians will actually need to research more, but we'll actually find out and put it here on Report Card how you can assess those special funds and how Nigerians, the ordinary Nigerian out there, can assess this special funds, or what criteria need to be met before the special funds are assessed.
Okay, interestingly, it said funding budget support, which is critical. It said health budgets increased by 52% between 2023 to 2025. It said $200 million approved to sustain HIV, tuberculosis, and malaria program. Quite a sustainability there.
I think you go back, funding and budget support, health budget increased by 52%.
Yes.
$200 million approved to sustain HIV, tuberculosis, and malaria programs. Okay, we'll take a short break. Nigerians, this is still Report Card. Report Card is that platform where we feel you should encourage persons you've put in trusted positions to submit their achievement record and reports for us to put it out there for you to see what they are doing to better your lives. My name is Iyasu Yali Peters, and I have Dr. Clet Ako, a development expert, in the studio with me on Report Card. We'll be back soon. Welcome back. This is still Report Card, and I still have Dr. Clet Ako, a development expert, with me in the Report Card studio. We have the Report Card for the Honorable Minister for Health and